Okay, Vic. Hello, everybody. Today we are joined by Aubrey McCarthy and Sarah Curry. And I'm just going to allow Vic Neufeld to do a couple introductions about the BC Coalition Institute, and then I'll be happy to introduce our guests for today.
Greetings to all. Very, very good you could join us. So I guess for Aubrey and Sarah, you likely heard something about the BCCI from Raluca and others. It's an informal network, I guess you could say, of people throughout BC, particularly interested in global research, global health research. We've met, I guess, 3 times over several years in 1-week events, with the exception of this last one, which because of COVID was a more distributed event with colleagues in, I think, about 8 places around the province, with a symposium just a few weeks ago. We I should say, in the symposium, we made a special point of talking about synergies and harmonization. So I think today will be a really good example of work that you folks have done with these various agencies in the Lower Mainland. I'm looking forward to hearing much more about that. I should also say that I live in Victoria, so I want to acknowledge the fact that with respect of the Logan speaking people and traditional territories of several groups, the Songhees and some others. I think that's all I need to say. Perhaps I'll just mention that Katrina, who's just joined us, will be listening in, and she will do some reflections toward the end of our hour. So we'll just keep an eye on the time about then to make sure that Katrina's got a bit of time to give her reflections then. I think that's it from me. Over to Raluca.
Thank you so much, Vic. And before I begin, I also want to acknowledge the land on which I join you from. I'm joining you from Vancouver, BC, which is the land, the unceded, traditional, and ancestral territory of the Musqueams peoples. And to that, I give thanks each and every day as we honor this beautiful space that we're in. So just a little bit about my work for BCCI. I've had the pleasure of being with this group for a couple of years now, and it's really brought me closer together to my passion for planetary health. And so being part of this community of practice has really allowed me to see the different lenses through which we can actually enact change and to uphold equity at the center of everything that we do. And so I was fortunate enough to meet Aubrey through the work that I do at UBC, and we're working together on a grant specific case study. And when she's told me about the energy and environmental sustainability team with the BC Green Care, I was very curious and keen to learn more about that work, especially at the intersection of healthcare and institutions in health that try to raise the notion of sustainability and integrating that throughout different health authorities in the Lower Mainland. So I'm really glad, and I want to give thanks to Aubrey and Sarah for joining us today. They're sustainability consultants, and I just want to pass over the baton to them to do their introductions on the work that they've done. And with that, again, I just want to give my thanks for the time that you're taking to be with us all today. So take it away, Aubrey and Sarah.
All right, well, thank you so much for those introductions. It's great hear a little bit more about who's part of this coalition, and just to learn about the work you're doing. So yeah, as Raluca mentioned, my name is Aubrey McCarthy, and I'm a sustainability consultant, and I work with the Energy and Environmental Sustainability team. And we serve the 4 Lower Mainland health organizations, so Fraser Health, Providence, PHSA, and Vancouver Coastal. And a lot of my work right now revolves around supporting leadership and innovation projects, as well as food-related initiatives. So I'm really excited to be able to get my hands into those projects. And yeah, Sarah, she can share a bit more about some of her experience too. So I'll pass it over.
Thanks, Aubrey. So it's lovely to meet you all, and thanks for having us. And as Aubrey said, I am also a sustainability consultant with the Energy and Environmental Sustainability team. And alongside Aubrey, focus on leadership and innovation and working on staff engagement and communications initiatives across the Lower Mainland health organizations. Another program that both Aubrey and I co-lead is the Green Plus Leaders program, which we can dive into a little bit when we go through our presentation. So perhaps that's a good place for us to go next. And I think, Raluca, if you can make me a host as well, I can share my screen and then I can pass over to Aubrey to introduce our presentation.
Hey, Sarah, I think I did just make you a host, so something should have popped up.
I don't know if that's worked. I don't see her as host.
Not yet. I think Aubrey definitely got hosting abilities.
Okay, maybe I can.
Because I don't have that function.
Oh, I can make her a co-host.
Okay, good.
Yeah, I think I got rid of my ability to make you a host by making Aubrey the host. So
sorry about that. That worked.
I'll make you a host too.
Okay, awesome. Thank you.
Great, thanks, Sarah. That looks good. We do have the presentation form showing right now, I can see. Yeah, while Sarah's getting that sorted out, I just really want to take a moment to kind of ground ourselves today and to acknowledge where we are. I don't know where everyone's calling in from today, but just to think about, what's around us and the history beneath our feet, and to remember that the spaces we inhabit have its own story. So Sarah and I, we both join you by acknowledging that we work and on the shared territories of the Musqueam, the Squamish, and the Tsleil-Waututh nations. And we're really grateful to be able to work here and to be able to live our lives on this land and these waterways. So yeah, we'll just go ahead and dive into our presentation here. So today we're planning to cover a little bit of the history of the Energy and Environmental Sustainability team to give you more perspective and understanding of the work that we do, and then the BC Green Care Initiative, as well as just show you a few projects that we're currently working on and things that are in development. So yeah, we're excited to have you to ask any questions. You can either pop them in the chat. We'll also have some time at the end for Q&A, but we're welcome to hearing what your thoughts are. So yeah, stay tuned.
And so this next slide really is an attempt to give you a sense of where our team sits within the wider health system here in BC. So we're going through a strategic framework refresh with our team at the moment. So we're working through a lot of this together, but this is an attempt at sharing how we sit within the system and all the different initiatives that we kind of have within that. So we obviously work very closely with not just the Lower Mainland health organizations, but also with the wider health system in BC and our other external stakeholders. And so, as we mentioned, we work on behalf of Fraser Health, Providence, PHSA, and BCH as well. So ES sort of sits as a collaboration program within those 4 Lower Mainland health organizations. Now, we certainly do collaborate and work closely with colleagues in our other health authorities in BC, Interior, and Northern, and Island Health as well. But these 4 health organizations are our scope of work as it stands today. So our team is a collaborative program of those 4 health organizations. And our renewed purpose statement is to inspire and empower all that we work with to collaboratively enable systemic transformation. And at the heart of what we do, it's all about this interdependence of people, place, and planet, now and for future generations. And so we have a call to action, and essentially what we're really trying to inspire is healthcare community, both clinical, non-clinical staff, medical staff, to take action and transform their workplaces. And we also have what we call our Green Care Network. And this is a network of healthcare staff, participants that have interest, and at different levels, we engage with them to get involved in the work that we do. So it's a brand, it's a network that was facilitated and is founded by our team, and it's all about uniting efforts within our healthcare community. And again, coming back to our goal being kind of working towards environmentally sustainable and resilient care for healthy people, place, and planet. And so our team has a Green Care website, which I can show you a little bit later on. We've actually just refreshed that website, which we're very excited about. So very happy to share this new version. So we have a website, which is our home really for communicating the work that we do and the work that we are aspiring others to do with us. And this is really the home of that Green Care Network. So as I mentioned, we have this Green Care community, which is a group of participants, and essentially there are different ways that people across those 4 Lower Mainland organizations can get involved. So you can subscribe to our e-newsletter, we have lunch and learns, we have stories. And then what we also have is a more deeply engaged group of staff, which is through our Green Plus Leaders program. And there are staff that have been involved in this program since its inception back in, I believe, 2009. And it was actually brought over from UBC with their Sustainability Ambassadors program. So there was a lot of synergy and a lot of crossover and inspiration to start a similar program here in healthcare. And so just to touch on our focus areas as a team have just been refreshed as well, but we focus on food, water, materials, leadership and innovation, which is where Aubrey and I come in, energy and carbon. We also work on climate and transportation. And we're trying to highlight here too that all the work that we do is interconnected and we work closely with our different colleagues, but we're also trying to find new ways to interconnect our focus areas together as a team. So I'll hand back over to Aubrey to talk us through some of our focus area.
Great, thank you, Sarah, for sort of laying the foundation. So the focus area that Sarah and I work on is leadership and innovation. And what we really are trying to do is to foster a culture of transformative leadership and innovation for environmental sustainability and climate resilience within healthcare. You can go to the next slide. And so what we do is we work with the Green Plus leaders. We have educational sessions for them to get involved and to really learn about how they can make a change. And so we do this through really building up, giving them teaching skills so they become role models, and teaching them about behavior change and how they can influence their coworkers. We also work on helping them to improve processes and to create that culture of environmental health and wellness within their workplace. And essentially it's a place where people can come together similar to this coalition and to network, to share ideas, and really to learn from one another. Recently we were just on a call with a Green Plus leader, and she was just talking about how she really needs to have ideas from other people to hear about what's worked well for them or what challenges have they faced in their department, and then how can she learn from that and be able to make the change in her own department. So there's a lot of cross collaboration. And then we have, just to give you a little bit of an overview of how many people are involved, we have around 230 Green Plus leaders, and this is just a kind of a scope of where they're at. So we have a majority that fall between PHSA and Fraser Health, and starting to grow more in Providence Healthcare and Vancouver Coastal. We run our program right now on a bit of a school year calendar. So really starting with training and orientation workshops in the fall, and sort of equipping those Green Plus leaders with some of the skills and that they'll need to be able to implement projects throughout the year. We do different peer learning sessions and webinars, so folks can come together, and it's been really nice to have these webinars just to give people an opportunity to discuss big ideas that we we present them. And then we do quarterly e-newsletters to communicate with them. We also, in the past, we had held lunch and learns in person, which were great opportunities to get together and, learn about a topic over lunch. We have toolkits and resources, and we'll take a look at those a little bit later on our website. And yeah, we also provide funding. So we work with departments across different health organizations to partner together on funds, so folks can actually start up a project that they have with a little bit of seed money. And yeah, that's been really successful in the past. And then we usually end the year with a bit of a celebration, looking at the achievements that the Green Plus leaders have done throughout the year.
Okay, and so we just thought we would spotlight a few of our Green Plus leaders. We just completed a Together campaign, is what we call, for raising awareness of the Green Plus Leaders program across the health authorities. And so this is Jody. She's been a Green Plus leader for about 4 years. And really what this campaign is all about is just highlighting the importance of them. And it's all about you to contribute to planetary health. And so Jody's been involved in lots of different projects. She's a medical laboratory technologist at St. Paul's, and she has been involved in numerous projects, but this was just one we highlighted, which was collecting pens in the lab, recycling them, writing our own sustainability story. And this is Corinne. Corinne has been a Green Plus leader, I believe, for just over 2 years. And just speaking to what Aubrey mentioned about seed funding, Corinne applied for funding. They've created safe storage for bikes, which has encouraged more staff to cycle, particularly at their site. And again, that kind of speaks to the crossover that we have with our focus area, with our transportation focus area too. Is Rashmi, Dr. Rashmi Chadha. So Rashmi is a physician at VGH and has set up a monthly Green Corner section on VGH Psychiatric Newsletter. We also, and I'll share more about the VCH Spark platform, but last year an OR Spark Challenge was launched across the entire VCH community about ways to make the OR more sustainable. So Rashmi was very involved in that and has been a Green Plus leader again for about 2 years. And this is Rick. So Rick is with Fraser Health, and Rick works as a senior manager of facilities and maintenance operations with Surrey Hospital. And again, this one's speaking to our energy and carbon focus area and trying to look at installing new boilers to reduce energy consumption. So we have Green Plus leaders in many different departments across each of the health organizations. And it's something that we're continuing to look at, is where are the gaps and why are we trying to focus on facilities management? What's the importance of working with physicians across the system, and also our corporate staff too. So they're from all walks of life. And we just thought we would spotlight a few for you here. And this is just a little bit more. So we have sustainability innovation funds that we offer, not just for Green Plus leaders, but for the wider Green Care network. And these are just some that have been active in the last year and a half. So the VCH Planetary Health Spark Challenge is currently open to, it was just for Green Plus leaders at VCH, but we've actually just opened it up to the entire VCH community. So anyone who works or is affiliated with VCH can submit ideas that advance planetary health at VCH and in their workplace. And that's in collaboration with the Transformation Office. So we're offering $1,000 per idea, and all in-scope ideas will then be put forward to a vote. But we're hoping that we have capacity to support most, if not all, of the ideas. Then we also have a partnership with PHSA, with their Health Promotion Initiatives Fund, which they run every year. And we saw an opportunity a couple of years ago to embed a sustainability piece to that Health and Wellness Fund. And so we've been doing that one for 2 years. And again, it's about $1,000 that we provide to support PHSA staff to implement their projects. So anything from community gardens to bike storage upgrades. And that's been a super fun and successful project for us. And then we also have a Providence Sustainability Fund that right now we're still looking at who to collaborate with in the future, but that was directly supported by the CFO and his office. And he is also a Green Plus leader, which is very helpful in kind of bringing about new initiatives and new funding opportunities at Providence. And then finally, Fraser Health. A couple of years ago, we started to collaborate with their existing Exnovation grants. So working with their Innovation Planning and Transformation Office to add sustainability as a component. And that was all about reducing and eliminating waste. So we supported, at the time it was 3 projects. Now because of the pandemic, we had to take a slight pause, but we're hoping to bring that back to life again in the new year. Aubrey.
Thanks, Sarah. Yeah, we just wanted to share a little bit more about one other focus area, being food. And for us, food is really about how can we develop a plant-forward, local, culturally relevant and equitable food service to advance food as medicine. And you can go to the next slide. And for us, the concepts, of food as medicine or food as preventive medicine are of growing interest in the healthcare field. And it's still a relatively new focus area for our team. But we're really interested in how it intersects with environmental sustainability and social equity. So there's many different groups that are coming together in departments that are involved in food services, such as dietitians, population and public health, researchers, food service providers, and as well as physicians and sustainability teams. So there's a lot of work happening, and we're continuing to think about how our roles in relationship to food can contribute to this work. So yeah. So currently we're part of an initiative with Nourish. Nourish is working to, they have anchor cohorts right now, which are place-based teams that are made up of health institutions, really looking at taking a whole of hospital or health authority approach to working with their communities to experiment with opportunities around food as an upstream determinant of health. And so with Vancouver General Hospital and the UBC Planetary Health Lab, and let's see, we also have Aboriginal Health on board and VCH Public Health. So yeah, lots of folks coming together to work on this project right now. And the collaborative is really looking at, how can we take a more holistic view of food and health settings, acknowledging that food not only as an economic good, but really recognizing it as a power, as its power as a source of nourishment, cultural identity, and a link to nature along the continuum of care. So we've received a lot of support from the Chief Transformation Officer, Darcia Pope, and others at VGH. And it's a really exciting project, and it's just getting going. It's a 2-year program. So we're hoping to see some projects implemented in the coming year.
It's just not quite moving for me. There we go. Yes, so that is just a snapshot of the work that Aubrey and I in particular are involved in. But as we said, that the other focus area that we shared a little bit more about with respect to food is just one example of the other 5 that we also work closely with our team with. We have a team of about 19 staff at the moment. And in addition to the sustainability consultants and our sustainability manager, we also have a climate risk and resilience manager. We have then quite a sizable portion of our team are our energy managers and our energy specialists. So there's lots of other work going on that we could probably spend all day sharing about and talking about. But what we'd love to do now is just share with you our new website and just give you a sense of where you can find more information about our team and how to get involved. So I'm just going to share my screen. So this is our new website. And so it's just bcgreencare.ca. And when you hover over our work, this is where you'll see all the different focus areas that we work on. So if we just take materials, for example, which is one we didn't get to talk about today. This is our vision statement.
Sarah, I don't think I'm seeing the website.
Oh, Is anyone else seeing it?
No, I was going to intervene. I wonder if when you shared the screen, did you share the right screen?
Yes.
Yeah, maybe you just shared the PowerPoint also. Sometimes that.
There we go.
It happens.
Okay.
Yay. Okay.
Good now? Perfect.
Yes.
I'll take us back. So yes, this is our landing page at bcgreencare.ca. So if we hit our work, these are all the different focus areas that we spoke about earlier, and you can pop to any one of those to learn more about the work that we're doing in that particular focus area. And you can also filter by the health organization as well. So it gives you a little bit more about our goals, our impacts, how we're doing in terms of our metrics and our reporting and what our targets are for that particular focus area for that particular year. And then in some cases too, we have, as you keep going through here, we will have also it'll list who on our team is the person that you can connect with regarding that particular focus area. And then what I wanted to also share was more about our stories. So if you click here, this is the area we're really excited about is you can come here to learn more about really not just, and very much not just what we're doing, but what others are doing in the health system with respect to the various focus areas. So again, you can filter by health organization as well as dropping down. You can also filter by focus area. And it's all color coded, but hopefully nice and clear. And the other piece too that I just wanted to draw to your attention was in our Take Action, there's Rick again. And this is where you can learn more about the Green Plus Leaders program, you know, what it's all about, why we encourage people to participate. And then in here too, because obviously we're just a small team, we don't always know what's going on in the health system. We try to encourage staff to share their stories and tell us what you're doing so that we can make sure that we're communicating it to our wider audiences. So it's a little bit more about our team and how you can participate. And I'll stop sharing now. And our last piece was just inviting any questions that you might have, or we'll have our, I believe here as well, our information at the bottom in case you want to reach out to us.
I just want to start by just giving both Aubrey and Sarah a huge thanks. I personally really appreciated this presentation and getting to know a little bit more about, honestly, the amount of work that you're doing. As I'm sure, you know, you gave us a snapshot. There seem to be a lot of varied projects. So I definitely want to invite the audience to engage with our guests. If you have any questions, this is an opportune time to ask away. So anybody? I don't see, I'm going to be monitoring the chat. But
I would also be curious if people could introduce themselves just so we understand, you know, where you're coming from. That'll help us kind of direct the question too.
It's a really good idea, Aubrey. Let me look at my list. So I actually am going to start off the first person on the list that I see. And sorry, I don't mean to make anybody uncomfortable, but I see Katrina. Katrina, do you want to go ahead and introduce yourself?
Yes, sure. Hello, everyone. Sorry, I'm sneaking in some breakfast. It's nice to see you all. Thank you for your presentation and for sharing these thoughts and projects. It's really exciting to see. My name is Katrina. I am joining you from Kelowna, where I work with the School of Nursing at UBC, and have worked with Vic in sort of facilitating and convening the BC Coalition Institute Community of Practice for the last several years, and have worked in global health for a long time. I'm a nurse by background. I work with interior health sometimes, and all of the research I do as a knowledge translation and equity person is about advancing equity action. So I loved in your presentation, I just thought it's so lovely to see this work is very situated in people's everyday practices, everyday work, and emphasizing what they can do to be part of solutions. I really loved that. And I have just a question about which we can come to at another point, I'm sure, what the role that universities and students and researchers might play in this community of learning that you're building.
And I also see that Vic has his hand up. Vic, I don't know if that's a question or a comment, and we can come back to Katrina's question.
Carry on with the introducing folks, I think, and I'll come back to a question. It's fine.
Okay. Next up, I see on my list is Tasha.
Hi, everyone. Yeah, just to echo what Katrina said, thank you so much for this wonderful presentation. It was lovely to get an overview of the work, especially working with the BC Provincial Health Authorities, which is certainly no easy task. So I just want to commend all the great work and all the initiatives that you're taking. Yeah, so just to provide some background about myself, I am an MPH student at the University of Toronto. And many of the colleagues on this call are actually my classmates, and I'm very happy to see them join in as well. And I also support the BCCI community of practice, supporting Katrina directly and Vic as well. I actually did have a question too that I wrote down, and it just kind of has to relate to the big undertaking that this work is. I was wondering if you guys could talk about kind of the barriers that you face or some of the main challenges that you have to navigate by doing this very important work.
Very good question. Happy to take both Katrina's and Tasha's once we do a quick roundup, but I'm remembering them both to respond to.
All right, we'll go on to Christiana. Christiana, you're on mute. Not sure if you're around the computer. Okay, we'll come back to Christiana. Doreen is next on my list. Doreen, are you able to introduce yourself briefly and tell us where you're joining us from? And anybody who can speak or provide your messages in chat is also accepted. No, Doreen. How about Aisha?
Hi, my name's Aisha. Really nice to hear you. This is the first time I've been to any kind of webinar presentation about this, which is nice because I'm really passionate about connection to environment as a new way of seeing health and conceptualizing healthcare. I'm in Tasha's program as well. Yeah, I really like that you guys talked about food, because that's my interest is in food, as in our connection to the land and understanding how our health kind of revolves around that. And I know that Nourish actually has a Indigenous foodways program, Food is Our Medicine program, and it's just really nice to kind of hear you guys talking about that a bit more. And I'm just wondering how Indigenous partnerships are kind of involved with the work that you're doing. I'd love to learn a little more about that. Thanks.
Thank you so much, Aisha. Next up, we have Paneet or Paneet. I apologize if I haven't said that right.
No, that's right. Hi, everyone, I'm Paneet. I'm also Tasha's classmate doing my MPH. I'm actually from BC though, so it was nice to hear about the BC background, and I'm a research assistant at Simon Fraser University. Yeah.
Thank you, Paneet. Lindsay, are you there to speak to where you're joining us from?
Yeah, hello, I'm Lindsay. I am also in Tasha's program, so MPH at UT. But I actually also am from BC originally, so it was really great to hear the work that's going on out there, just because I'm hoping to make it back there and go into healthcare at some point. So that was really great to hear. Thank you so much.
Thanks so much, Lindsay. Almost there. Next person is Apira or Apira. Not sure. Oh, there we go. Hi.
For inviting us to this webinar. It was really great. So I'm also doing my MPH, specifically in health promotion at Dalai Lana, and I'm currently working as an outreach worker with a community health center in Durham, and I'm from Scarborough. Yeah.
Great, thanks so much for joining us. And last on my list is Heba. Heba, are you able to unmute yourself? Okay, I'm not sure if Heba's there, or Christiana or Doreen. Okay, so if we can move onwards. Hi, Christiana. Great.
Hi, so I'm Christiana. I'm calling in from Prince George. I actually did an internship in the EES unit. That was in 2018, actually, under the leadership of Sonia. Yeah, so it's interesting to really listen this morning to what you're doing, the exciting work, and now you're taking the work further. Thank you.
Thank you so much, Christiana. And I noticed, I don't want to put Prince on the spot, but Prince, I noticed you just joined us. We are just doing a very brief round of introductions. Do you want to just speak to where you're joining us from and what your background is in work?
Hi. Yes, sorry, I'm just out, so there must be noise here. So my name is Prince Edu. I'm a postdoc at the BC Center for Disease Control, and I also teach some global health courses at the School of Population and Public Health, UBC. Background in health systems research and infectious disease. Done a lot of work in TB, in Southern Africa mostly.
Thank you so much, Prince. I appreciate it. Sorry, I forgot to say, I know Aubrey knows me, but for Sarah and the others joining, I'm a lecturer at the UBC School of Nursing, and by background, I'm a registered nurse, and my passion lies in climate change and health impacts. So I just want to open the floor up now to Sarah and Aubrey and to the questions that were posed so that you guys can comment on those and maximize the time we have left.
Thank you all for sharing your backgrounds. It's really nice to see we're joined by such great folks from all over Canada. So it feels good. So I think, Katrina, your question around students, researchers, and how they participate and how we work together. So one of the examples I have, and I'm sure Aubrey has some others too, is we do work closely each year with the UBC Sustainability Initiative. They have a sustainability scholars project. So we actually bring scholars on board to help us with applied research projects. So special projects that we often wish we had more time and capacity to lift off the ground and see how that can help us with our programs. And that applied research then we typically use as a way to start new initiatives. So an example was just this year, Aubrey and I had a scholar, Sarah Pendry, who also works at VCH part-time on the clinical side as well, which was a really wonderful, background that we had from Sarah. And she worked with us on engagement metrics for sustainability in healthcare and how do we actually measure success when it comes to engagement. And Sarah created a framework for us. She looked at best practice. And that really has resulted in us putting forward asks to our leadership that we need more support. This is the different types of projects that we need to work on. So it's very much applied research, and we use that program every year. And it's been really wonderfully successful for us. I know, Aubrey, you might want to speak to a little bit more the UBC, the Planetary Health Lab, as well as a sort of a collaborative approach to us working together with UBC.
Yeah, I mean, the UBC Planetary Health Lab just started. It's a new lab, and it's led by Dr. Andrea McNeil, and folks on the EES team, on our team, we have one sustainability consultant who's actually on that committee as well. And so there's a lot of collaboration that's kind of going to be happening in the future. It's just such a new initiative that it hasn't really started yet, but we're really lucky to have UBC so close. And I think that there's opportunity, you know, to learn about what other universities are doing that have worked well in different provinces and see, you know, what we can expand on here and share with the UBC Planetary Health Lab. Yeah.
And I think the question around challenges, a great one. Just my thoughts on some challenges. I think one of our immediate challenges, you know, which is also an opportunity, is because we do work as a collaboration program on behalf of 4 health organizations, can be challenging for us to not just sort of build relationships, but it's about maintaining those relationships with respect to that particular health organization. You know, appreciating that every culture is a little bit different. So trying to navigate that can be challenging, especially with Aubrey and I's focus being so much on engagement. That's definitely a challenge, but also it's an opportunity because then your reach is wider. So you can sort of see both. I think a challenge, although we are seeing shifts happening, particularly at VCH and Providence Healthcare more recently, is how do we embed and, you know, transform the system? How do we create this this sort of, you know, planetary health or sustainability at the leadership level? And how does that become part of policy and part of strategy? So it can be challenging to do that with the diverse stakeholders that we work with, and recognizing that, you know, we are just one of a number of stakeholders who participate and are involved in sustainability within not just one health organization, but 4 in our case. So I think getting our message across and trying to, you know, engage leadership can be certainly a challenge, but we now have planetary health as a strategic priority for VCH. Now there's a committee that's forming, and that then has a ripple effect to our team and how we get involved. And likewise, at Providence Healthcare, they have sustainability now as a foundational principle. So there's shifts happening at the leadership level. So our job is to try and sort of bridge those, the leadership and then the grassroots, to kind of bring them both together. I don't know, Aubrey, if you've experienced any other challenges.
I think you touched on them. I mean, I think just capacity with staff, you know, we want to be able to make the learning possible and the actions. And it's just, you know, a lot of folks are doing this on the side of their desk. So making it worth their time and also finding ways to really amplify their work and their stories. So I guess a challenge, but also, you know, we get to celebrate too at the end of the day when we do see some of the wins that some of these small projects have. And then I think just kind of streamlining, like if something works really well at PHC, maybe it's not going to work at Fraser Health, and figuring out, you know, how can we adapt it and adjust it for that community and that culture. And yeah, just being able to kind of stay on our toes, to know that each health organization is different, and really, you know, being aware of the different needs from those communities. I think even just thinking about, you know, where maybe there was more impact from COVID, and thinking about how some of those staff members were able to engage more or less has been interesting to reflect on. Yeah, thank you for that question.
And I just wanted to say that, I think you touched on a lot of key points that oftentimes, you know, we may get so absorbed in the work, and now with the pandemic in parallel, it does create that substantial challenge of, you know, the burnout that people are feeling. And so how do you maintain that engagement throughout, while this issue is clearly really important and at the top of our list of addressing more sustainability in our workplaces. And I didn't want to miss out. I know Vic also had a comment, but Aisha had asked around the key around Indigenous partnerships. Are you able to speak to that and how you're integrating it through your work?
Yeah, no, of course. I really welcome the question, and thank you for asking. So with our work with Nourish, yeah, you know, how are Indigenous partnerships really involved? So when we created our, you know, who we wanted to work with, we made sure that Aboriginal Health would be able to join us. And so through that, we've had committee members that are part of this anchor cohort join. And a lot of our learning so far has been, based on, we do land-based retreats and just getting to understand the place where we are working and some of the challenges that are here, and getting just a better understanding of what is available food-wise, what is important, and kind of a lot of, I would say, relearning and just remembering, what food is available. With Nourish, they definitely take a seasonality lens to their work. So that's one thing I really appreciate, is they're thinking in cycles. They're thinking of, when can we dedicate more time to certain work? When is it more of a time to reflect and pause and think about what we're doing? It's a very systems lens approach. And yeah, they also have the Food as Medicine active, I think it's the learning series that they have available. And yeah, I haven't done it yet, but it looks like a very a nice course to take part in. So yeah, it's something that we're always continuing to work on, and it's really important to EES, and as well as not just food work, but to everything we're doing. Is there anything, Sarah, you want to add to that?
No, I think you captured it. And just the only other piece to say is through our strategic framework refresh with our team, we are a sizable team because we have the 4 health organizations. Part of that was sort of mapping and understanding our key stakeholders. And we very much recognize that, there's a very strong need to engage, continue to engage our Aboriginal health partners and other Indigenous partners as well. So it's something that we've sort of actively been trying to work on to make more of those engagement efforts and to ensure that the work that we're putting forward has that lens, that 2-eyed seeing lens to the work.
All right, Vic. Well, I want to get you to chime in.
Sorry, I didn't realize. Are you hearing me okay?
Yes.
I didn't realize my hand was waving away the whole time. And probably this is something Katrina's about to say, but I think there's a real opportunity. Well, back a step. Those of us that were part of our symposium a few weeks ago know that we made a special point of thinking about synergies and harmonization. And this hour is a wonderful example of possibilities there. A thought. Several of us are from the 3 health authorities that are not represented in your group. So the island, interior, and northern. We have quite strong links through our network to folks in these 3. And I'm just wondering whether we could think of some kind of a pilot where I would say within a given municipality, because that's where there's sustainability, leadership, policy development, and so on, where university folks and healthcare folks could work with a municipality on a particular project, whatever that might be. But it might be a good way of bringing together the healthcare community represented by you folks, our link to universities, and people that make decisions year by year about the plans for a given municipality. I'll just put that thought on the table and come back to it as needed at some point. Thanks.
Thank you, Vic. I think that's a great idea. I might have mentioned this back to Raluca a while ago in a conversation, but I was involved in a Master of Education at UBC, and we worked directly with the city of Vancouver and City Studio to implement projects that were on their, what was it, the climate action mandate that they had. So they had different activities that needed to be reached. And so, yeah, we made this kind of linkage between students and the city to carry out these projects. And I think it would be really neat to see something like that for the healthcare community.
we should give Katrina a chance for her reflections before the hour is up, I think. Is that okay, Raluca, with you?
Oh, absolutely. Happy to share the platform as much as possible.
Well, it's such a nice conversation, and I have a long list of notes on a paper here. One of the things that really makes me think about, so I was thinking like Vic about our desire to foster harmony and synergy where we can, and about we have these sort of many passionate communities where there's networks of people who are all trying to work in sort of similar directions, but there's a lot of fragmentation and things that keep us apart. And as I was listening, I realized I wrote down 3 things about UBC, which is an institution I'm part of, and yet I didn't know about. And so there's new people that it makes me think about connecting to, and about how to invite more alignment, more harmony between our efforts. And I think about like between the Planetary Health Lab, the sustainability team at UBC, the School of Population and Public Health, which I'm involved in some early conversations about how to create a more cohesive presence in thinking about global health researchers in general, who we've tended to lean on definitions of global health that I think are very rightly criticized for their coloniality. And really, when we think about climate justice and climate action and how we can act, I think this kind of work really invites us to be very thoughtful and reflective of reshaping our notions of what is global health. And to me, global health always has been about the lens that we look at the world through. And that's, for me, a lens where things that are happening at a high level, at a global level, forces of political economy, issues that are inherently global, these manifest in our daily lives. And so it's not so much about some sort of elite Northern expertise being positioned in a savior role for anybody, but rather a much more proactive acceptance of the interconnectedness of all of our lives, and that what we are doing, no matter where we are, has an impact on others, and what is happening outside of our control has an impact on us. And so we should all care about it and be working together toward solutions for it. And so I have questions. Prince, you brought up the last time we met about really being intentional too about engaging students. And so when I think about research and universities and the role that universities might be playing in these sort of in inviting harmony and synergy and inviting being part of solutions, I think about how can we work together to align student engagement in projects in meaningful ways, so that, you know, there's this tremendous desire and passion from young learners, emerging leaders, to do meaningful work. And a lot of times our students are sort of, I get very critical and upset when I see students sort of left floundering to kind of cook up an idea on their own that's based out of problems that they've identified in some gap in the literature, when we know there's problems with the literature and representation and voice. So these are ways, if we could just find ways to work together more meaningfully, and maybe just slow our pace down enough to listen to each other a little more. It gives me a lot of optimism for the possibility of harmony. And it makes me think we have a little grant to convene a meeting sometime. I think we'll end up sometime early in the new year, but maybe some of this conversation can show up again in our efforts to convene in Vancouver sometime I'm thinking by mid-January or early February. That's a lot of rambly thoughts, but anyways, that's sort of my reflections on your presentation. I really appreciate the opportunity to hear from you today.
Sarah and Aubrey, I don't know if you want to respond to Katrina's really deeply reflective comments.
I really appreciate it. And I think you're right. I think we as a team are constantly trying to evaluate how we approach our work, who we work with, how we co-create, how we co-develop. So completely hear you. And I think that it sounds like there's a lot of alignment there. And I think you're right around, you know, connecting with our students, the research community. There are also research institutes within our health organizations, and we're trying to work more closely with them to look at, what are the new emerging trends and literature that we need to be aware of. As you say, sometimes literature is outdated. So what are we working from? So we'd love to continue to see how we could, align that together and we'll develop some new initiatives in the new year. So, and, to your point, Vic, around the health authorities outside of BC Green Care, what we do, BC is part of BC Green Care. So we've often asked ourselves in the past, our ideal state would be that Green Care is not just, our Lower Mainland health initiative, but it's something that actually involves the entire BC community. And we do have folks that register for our Green Plus Leaders program who are not based in the Lower Mainland. They're based in the island, or they're based in Kelowna, or they're up north in Prince George. And we always invite them, we welcome them in, because we need to hear what their learnings are and what their workplace looks like. So we're starting to look at that too, and how we expand that. So again, definitely open to any more of those collaborations.
Well, just to jump in, I think our group could be a link for you, certainly to these three health authorities. Strong group at UNBC with Christiana, strong group with Interior with Katrina and friends, and then a few of us here on the island. So, for example, it'd be lovely to know who in your leadership group is actually from Vancouver Island Health Authority, and we can make connections and do work together, something like that. So.
All right, well, oh no, Sarah, go ahead.
I was just saying, I'm writing that down. I'm gonna follow up.
And Aubrey, did you have any other comments? I noticed you were going on off mute.
Oh no, I just thank you for the reflections. It's really nice to hear those. I think Sarah answered them all.
Great. Well, just being mindful of time. And I know, again, I just want to say a big thanks on behalf of the entire BCCI community of practice and those who are members with us. We really, really appreciate Sarah and Aubrey joining us today. And hopefully this kind of webinar has inspired those of you who will be listening to the recording later on to connect with us, because again, we're all about connection and about continuing to build this community of practice. So stay tuned for future webinars popping up. Thank you, everybody, so much.
Thanks to Raluca for organizing this. Great.
Thank you for having us.
My pleasure.
Thanks, Raluca. Thanks, everyone.
Stay safe.